walking off the job and walking on the picket lines. You're seeing that with regards to Ontario's schools. Ontario's laboratory professionals are also raising concerns about staffing, and they're asking the government to help alleviate the pressure. Michelle Ho joins me now. She's the CEO of Medical Laboratory Professionals Association of Ontario. Michelle, thanks a lot for coming back here on CTV News Channel.
Good to see you.
I think we can say our conversation continues. You've been sounding the alarm on staffing shortages, burnout, leading to, of course, as you raised concerns, delays on testing and testing results. Talk to me about how long this has been brewing. Is this a symptom of the pandemic, or are we talking well before that?
So it was a shortage that we were dealing with prior to the pandemic. 70% of our labs were short before we started. Now we are looking at 2.5 years later. We've got, additional COVID tests, millions of COVID tests that have been added. And then we sit here today looking at a group of people that are completely exhausted, now that are starting to see early high levels of RSVP and flu in our labs. Mm-hmm. This is a group of people right now that we are asking a lot of, but it's time to start directing attention to the fourth largest healthcare profession in the province. So we need to start paying attention to them.
Are you hearing, or what kind of response are you hearing from the government about this?
So we had a really good day Thursday morning. We were in to see a variety of MPPs. They are all very supportive of the need to really look at investing more. We are going to apply for an application with funding to look specifically at helping our training spots in hospitals. That's where the big gap is right now. They were very supportive of that. But we want to keep reminding the government that when we have conversations around human health resources, we are looking beyond just what we can see, which is physicians and nurses. We need to look at what's happening in our lab.
Yeah, exactly. And I was going to say, because timing is critical in all of this. You're already dealing with and continue to deal with that backlog prior to the pandemic. Now it became even larger with all the testing that you're being done. What's the concern in terms of the added strain that we're already seeing on the healthcare system in terms of, patients, but doctors, healthcare workers in need of the information that your laboratories provide them in order to treat their patients?
Very, very good point. So one of the biggest concerns we're starting to see now is the testing turnaround times. We have a delay in those times. We are talking about people in Ontario that are having to wait days, weeks, months, and now years for results. Mm-hmm. Specifically, I'm going to give you an example. So we have very specialized testing when we talk about genetics. So we have medical lab technologists that spend time looking at genome sequencing. Right now, the testing for that area could be up to a year. We're talking potentially a 39-year-old woman who's waiting to see decisions around having a child. Right. Would need to wait that length of time. That's not fair for her. It's not fair for making decisions of her future. Yeah. So we really need to start looking at, these are people that provide testing so the entire healthcare system can function. So let's pay attention to them. Angie, we've talked about this. They cannot strike. They cannot walk off the job.
My gosh, no.
Like, if they did, people would die. So we need to make sure that they are a priority when we're talking about investments.
Well, we're going to keep a close eye on that. As you say, timing has to be yesterday, not today, not tomorrow, but it has to absolutely happen immediately. Michelle, we'll keep an eye on it. We'll certainly be speaking to you about it. Michelle Ho is the CEO of the Medical Laboratory Professional Association of Ontario. Thanks again for this, Michelle.